Nothing could have prepared me for the journey I was about to go on. For months, we were preparing to oversee eye camp surgeries that were about to happen in Bura County, Kenya. SubhanAllah, the thought of witnessing people who were blind for 3 years, some 10 years, was something that I could only imagine. Once we arrived in Nairobi, we met with the Bura County representative who speaks for his people and advocates for healthcare and infrastructure.
Bura is the northern end of Coast Province. It has a population of almost 100,000 people. Largely, the population economic mainstay there is pastoralism. They do bits of agriculture and livestock rearing. That's what they depend on mostly. Is amalgamation of minority communities. Everybody you find in Bura is a minority. That's the inhabitants.
With him was Dr. Mahmoud Sheikh, who helped facilitate this project, and he shed some light on what the surgery entailed and what to expect.
Cataract is the process by which opacity occurs on the eye. That opacity actually makes an individual not to be able to see. It is not very complex simply because it is a process, surgery can be done within 20 minutes, 25 minutes.
We set off to Bura. I was excited, but nervous. We received information that hundreds of people had gathered at this place and that doctors were doing pre-screening, checking their blood pressure and sugar levels of the patients. When we arrived, there was a buzz. Hundreds of people gathered at this maternity ward, transformed into an operating theatre for the next few days. People were hopeful about the possibility of seeing again. One by one, they went through the pre-screening and then went straight into the operating theatre. It was at the pre-screening that we met Ibrahim. He'd been blind for 4 years and he was there on the first day with his nephew. The doctors gave him the approval to go into surgery. For 20 minutes, we waited in the operating theatre, praying that it went smoothly. The surgery went well, but we had to wait until the next day to confirm if the surgery was a success. We arrived early the following day. Hundreds of people gathered outside of this ward, waiting for the doctors to uncover their bandages, waiting to see if their vision has been restored. Ibrahim was amongst the crowd with his wife and nephew. He was the first to have his bandage removed, and what we saw next brought us to tears. After the doctors ran some quick tests, SubhanAllah, all we see is Ibrahim stand up, raise his hands to the air, and thank Allah and all those who supported him in this project for the ability to see again. Ibrahim is one of millions of people affected by cataracts. This 20-minute procedure could have lasting effects, not just on those who are blind, but those around them who have to care and help them in their everyday activities. Support our preventative blindness project with MAA so that people just like Ibrahim can have their vision restored.